Marjan laid out the results of the FDA trials and how wonderful they are. But sometimes, as a clinician, there's a disconnect between what the FDA trial says and what happens in real practice. And this has been one of those times when I've been extraordinarily pleased that the clinical care that I'm providing to patients has really shown that the FDA trials are accurate. If anything, I think it's even more effective than we saw in the FDA trials. And as we said, it's all about cost effectiveness. So you have to rationalize why this is important for clinicians to have available to them and why payers should pay for it. And overwhelming, my patients are extraordinarily happy, number one. But number two, I'm simplifying their regimen. They're going off of other medications and they're able to function more effectively. They're using less medications, such again as immunomodulators. They're using less other treatments. And I think at the end of the day, this is going to be a significant cost savings to the insurance companies and the third-party payers when you make the right diagnosis. Treating the wrong disease with a drug or using a drug to treat the wrong disease is just basically a waste of effort, a waste of time, and not effective. And I think we've been doing that much too often in the past. Now we have a better understanding of what the best way of treating certain ocular surface diseases is. And I think that's going to create more effective therapy and more cost-effective therapy at the same time.
And I think in fairness, payers are on the same page. We'd rather treat the cause rather than the symptoms and address it and hopefully cure it. And this is a rare disease that you actually have a cure, right? So there's not very many of those.
And also, the conversation is much easier with the XDEMVY, knowing that you can say it's going to be a 6-week course compared to a constant copay. So it makes a difference.
So again, going down a rabbit hole, minor question, but that's a concern that comes up on my side fairly often is, given the eradication rates and the treatment duration, how often are you having to retreat?
So that's a great question. It actually brings me to my next question, Jeff. Thank you for that segue, because I was going to say, okay, how are we following up with these patients that we treat with lotilaner? It's a 6-week treatment. Initially, I would bring everybody back in about 6 to 8 weeks because I wanted to see, is it really as great as the FDA studies showed? And I have to agree with Eric that it's not only as good, but maybe even better and more impressive when I see it live after I've treated patients. They come in clear, patients who've had issues for years and years. So it's been really nice. So now the nice thing is I don't need to have the patients come by. I say, treat for 6 weeks. I'll see you in a year. Come and see me sooner if you need. So the follow-up visits have gone down versus when I would put patients on something like a dry eye treatment for blepharitis or something that wasn't as effective. Patients would just keep coming back because they said, I tried this, it didn't work. And then we'd go through this whole, okay, let's try this. Now let's try this. And it was, a lot of clinic visit time too, and what we call chair time. Patients would keep coming back to the office. Now, as I'm feeling more comfortable with the results of lotilaner, I say, just, you're done. Take this for 6 weeks. I'll see you in a year because I'm confident in how it's going to work.
Yeah, these patients have overwhelmingly seen a number of doctors. We had a patient, Marjan and I spoke to in Boston last week, who'd seen 15 different eye care professionals. And these patients are obviously frustrated, but they also come in with an enormous bag full of medications they've tried, showing us all the things that did not work. And the cost of all those medications in that bag has to be very significant. We've now simplified things. As Marjan said, my experience has been, I tell patients come back in a year unless you're having a problem. And we are having less post-op visits, less follow-ups, and the patients are very much happier with their therapy and they've simplified their lives as well. So again, this has been one of the fallouts of using lotilaner is that we've made their lives simpler, and by making it simpler, we've also made it less expensive.
And Paul, go ahead.
Sorry,
go ahead.
I know it's hard when I'm not on.
Our patient.
And I'm not on video, so I apologize. I'll make one other comment. As was asked, I think Jeff asked about, and you did about repeat patients. I think part of the problem is the drug works so well that patients are feeling great at 1 or 2 weeks, and so they discontinue it. And the few patients, so it takes a lot to educate them to say, hey, it doesn't take a lot, but it's very important to educate them that there are two life cycles of this microorganism, that and the eggs. And so really the 6-week therapy is key. And so I have had very few patients so far. And again, the drug has only been available now, has not been a year. It was approved in July and only available later in the fall. So we don't know how long to stand, but the few patients that have had to come back for retreatment are the ones who didn't follow the whole 6-week therapy. And that was only at the very beginning. I felt like we were educating them well, but it wasn't enough. Now we're very strict on saying, here's why you have to use it 6 weeks. And I do not see many of those patients returning for another treatment. There will be a percentage, I guarantee it, that won't make it a year. And the studies even showed there were some patients. But, a lot of patients will still do some minor hygiene in between to keep the oils down with just lid hygiene. I think that may extend it too, and that's over-the-counter products, because that wasn't allowed in the clinical trial, and we still saw impressive efficacy of the duration of a year. And I think what really impressed me with the efficacy data or the durability data is that even the redness of the eyelids stayed lower. It actually got lessened between the primary endpoint at around 6 weeks and a year later when they did the extension study. So that means once you control this disease, the body can heal itself up. At least that's what it's indicating when you have less erythema over time. And I think that's what we should expect in a lot more percentage of our patients. There will be some that'll need a retreatment, but so far it has not been a very high percentage in my clinical experience if they follow the directions, and most do, fortunately.